Who knows what this is? I'm quite sure some of you will start to see faces, but this might look a bit more familiar. I think you all know this. This is a pacemaker, and on the left-hand side you see its 70 years old variant, a pacemaker from the early 50s. This is today's variant of an insulin pump, and on the left-hand side you can see its moonwalk variant from the early 60s. This is how your appendix is removed today, or will be in 5 years, if you are unlucky, that is. In the 19th century, they had this portable device for that. I think we all agree these are exciting times. A lot of things are changing. The trends we have seen over the last century, and then the changes over just the past decade. I just showed you 3 examples. Imagining us having this presentation in 2030. We're on the verge of nanobots, nanorobots, removing cancer cells, fixing vessels, transporting platelets. And although this is just an artist's impression, we are seeing now lab examples of microscallops designed to navigate, to swim in body liquids. This is an in vitro result of such a scallop, supported by CFD simulation results, computational fluid dynamics, to look into behavior, velocity, and how it would move through the body. So, who of you is wearing Google glasses? I don't think you needed to tape this presentation, but I guess some of you are wearing an Apple Watch or a Fitbit or another smartwatch. Who of you has a smartphone? I guess you all have. You know where I'm going to. Steps, stairs, heart rate, blood pressure, saturation, temperature, position, posture, video, audio, wearables, sensors for monitoring. More than 62% of you today are wearing wearables. Smartphones as a sensor of a wearable not taking into account, because that would make it the full 100%. By the way, to be clear, apart from the Apple Watch Series 4, none of these, or most of these, are not medical devices. They just give you insights and some monitoring capabilities. And I think it sets a trend. 2020 versus 2010. There are much more disruptive innovation possibilities right now and perhaps in the next decade than there's ever been. And that might bother the big old platform companies. I think they are growing more and more concerned. On the one hand, they have huge capital bases, but very often they don't know how to disrupt. And if you look into some of these trends, like direction towards wireless devices, IoT, Internet of Things, combination products, not only like in drug device combinations, but also like in device medical app combinations. The wearables from the previous slide, devices that stick to you, real-time monitoring, bye-bye to the spikes, very important for predictability. Lab on chip, organ on a chip, and building point-of-care solutions with that. A very clear evolution from bench to bedside. Linked to that, personalized medicine, both in diagnosis and therapy. Closed loop devices, thanks to compactness, high throughput, and that combined to the big buzzword, big data, AI. And all of these trends are driven by technology and technology and technology, combined with the availability of those sensors in the wearables, going smaller, miniaturize, and yes, building nanobots, the need to engage the patient, putting a nanobot in a patient or an implant or making him wear a sensor day and night is going to be another ball game compared to measuring blood pressure twice a day or perhaps twice a year. Frontier discovery work. That is what I imagine you do in your labs, going out and finding therapies on the leading edge of technology and things that are way far out of my league. I'm an integrator and implementer. We wait until you've got something really good on a petri dish. We are not a research company. New tech solutions, new combinations, and we will make it work. We will build a combination. And the key in that will be cost and efficiency, but even more important, focus on compliance. Compliance will be the key of everything in the near future. So in order to successfully tap into these trends and these drivers, there's three things to look at. Without trying to repeat myself too much, there's human needs. The first box on the FDA's list is to find out who your users are. It doesn't start with the patient and ends with the doctor. To make your device or solution work, there's a full chain to be convinced. We don't make it easy for nurses or doctors, for technicians, for maintenance personnel, for users and patients. I think there are huge opportunities to be more efficient, to make doctors and nurses more satisfied and able to better focus and make less mistakes, and to save money at the same time. Secondly, and we'll come back to this later on, but with regard to market focus, you should know in advance your regulatory strategy, the segment you're working for, and have a strategy for compliancy and reimbursement in place. The third pillar, technology is the huge enabler this decade in early stage detection, discovery of new therapies, integration of robotics and sensors, and of course, intelligent system and data. Intelligent systems still in a master-slave relationship, but in the next wave, more and more data and intelligence will make firm and right decisions for us. And we are lucky because it's a big market. 100 billion in Europe alone, more than 500 billion combined with the North American market, and with a growing number of applications, technologies, and combinations in all medical device classes ranging from IVD, medical device class 1, 2, and 3. Driven by technology and with focus on personal health, the yearly growth rate in the sector is about 5%.